Hello, this is ambitious Dr. Ashwini, and today we will see the protozoa Entamoeba histolytica. So, parasites are classified into two, that is protozoa and helminths. Protozoa are again classified into amoebae, flagellates, sporozoa, and glides. Helminths are again classified into trematodes, cystodes, and nematodes. Now, the examples of protozoa like the amoebae is Entamoeba histolytica, flagellates. You can see these are the flagellas. The examples are Leishmania and Trichomonas, Toxoplasma, and Plasmodium malariae comes under Sporozoa. Now, the contents according to the CBDC pattern of second year BHMS pathology students is describe the morphology of Entamoeba histolytica, describe the life cycle of Entamoeba histolytica, describe the clinical manifestations of Entamoeba histolytica, enumerate the difference between amoebic dysentery and bacillary dysentery, and describe the laboratory diagnosis of amoebiasis. So we will see it one by one. Firstly, we will see the introduction of Entamoeba histolytica. So, Entamoeba histolytica is a parasite that mainly causes amoebic dysentery, that is, loose stools with mucus and blood, and extraintestinal diseases, that is, it can spread outside the intestine, especially to the liver, causing liver abscess. It is found all over the world, but it is more common in hot and humid places like tropical and subtropical countries. In short, Entamoeba histolytica is a parasite that usually infects the intestine, sometimes the liver, and is common in warm regions. Habitats. The tropozoid form of Entamoeba histolytica lives in the mucus layer and the submucous layer of large intestine, mainly cecum and colon. Now you can see this is the structure of Entamoeba histolytica. Here pseudopodium is given, ectoplasm is given, endoplasm is given, food vacuole is given, WBC, then karyosome, then peripheral chromatin and RBCs are given. Now we will see the morphology of Entamoeba histolytica. So tropozoites, precyst and in cyst form. So, tropozoite is the active feeding and multiplying form, causes damage, that is invasive form, and found in the stool of patients with active disease. Next is precyst, transitional stage between tropozoites and cyst. Then it is short-lived, not very important clinically. Cysts. It is a diagnostic form seen in the stool of carriers and patients. Immature form 1 or 2 nuclei, mature form 4 nuclei, that is quadrinucleated. This is the infective stage. So in short, the morphology is tropozoite, active and harmful, precyst, in between stages, cyst, infective and diagnostic. The life cycle of Entamoeba histolytica, mainly the host is man. The only one and only host is man. Infective form, mature quadrinucleated cyst. Mode of transmission by fecal-oral route, that is by eating or drinking food or water contaminated with mature cyst. Fecal-oral route means from the feces of one person to the mouth of another person. Development inside the human body. It comes under the life cycle. So ingestion of cysts. Cysts pass through the stomach safely, then enters the small intestine. Trypsin breaks the cyst wall. One cyst releases 4 small tropozoites. This stage is called excistation. Then in a large intestine, tropozoites live in mucosa and multiply. Some tropozoites transforms into precysts, then immature cysts and mature cysts. This stage is called as encystation. The mature cysts pass out in stool, survive in environment, ready to infect others. Tropozoites may also pass out but die quickly outside the body. This is the life cycle. You can see the man acquires infection by ingestion of food or water by contaminated with quadrinucleated cyst. Then it goes into small intestine. Here excistation happens. Then tropozoites are released. Here carried to large intestine. Then these tropozoites colonize or large intestinal mucosa. Then encystation happens. Here the cysts are formed, that is immature and mature cyst. From this releases in feces, and from here only mature cysts pass, and again the infection goes on. In this in this way the life cycle goes on. Now we will see this in the later part. You can see after colonization, trophozoites show different courses depending on host susceptibility. That is asymptomatic cyst passers in majority of cases. Trophozoites do not cause damage. They change into cyst and pass out in stool. Person acts as a barrier but has no symptoms. Then amoebic dysentery. In some cases, trophozoites attach to intestinal mucosa, produces flask-shaped ulcer in the intestine, causes bloody diarrhea, mucus and abdominal pain. You can see here these trophozoites are released into large intestine, and in large intestine the trophozoites can invade the large bowel, causing flask-shaped ulcers and bloody diarrhea. In amoebic dysentery. And the last one is invasive amoebiasis, which is a rare condition. Trophozoites invade deeper layers of intestine, means trophozoites enter and spread in deeper layers of intestine, then enter portal veins and spread outside the gut. Most commonly go to the liver. Amoebic liver abscess happens. Fever, right upper abdominal pain, enlarged tender liver. These are the symptoms of amoebic liver abscess. So you can see here, from here it goes here, and the necrosis necrotic abscess forms in the liver. You can see here, from here the colonies happens, and after making the colonies, trophozoites penetrate intestinal wall and are carried to extraintestinal sites and form the liver abscess. And again some of the colonies, few trophozoites releasing feces and disintegration happens. So in short, asymptomatic cyst passers has no symptoms. Amoebic dysentery has ulcers plus dysentery, and invasive amoebiasis forms the liver abscess. This is the structure of trophozoid: binucleated cyst, pre-cyst and mature cyst. So in short, the life cycle of Entamoeba histolytica is like that. Cyst, infective cyst, swallowed. Excistation in small intestine happens. Then trophozoites in large intestine. Here encystation happens, cyst in the stool, and transmission of the parasite. Then clinical manifestation of Entamoeba histolytica. Incubation period is 1 to 4 weeks. Asymptomatic carriers 90% has no symptoms, passes cyst in stool, that is act as a carrier and spreads the infection. Then intestinal amoebiasis 10%, amoebic dysentery, bloody diarrhea, may pass out stool up to 10 times per day, mucus and pus in the stool, colic abdominal pain, that is cramp like pain, and fever. Important note here is amoebic dysentery must be differentiated from bacillary dysentery, which is caused by the bacteria like Shigella. You can see the difference between amoebic dysentery and bacillary dysentery, but the bacillary dysentery is caused by the bacteria Shigella. Here, the pathology of amoebic dysentery versus bacillary dysentery. The ulcers are deep in amoebic dysentery, shallow in bacillary dysentery. The margins are ragged and undermined, that is irregular, uneven, broken and rough margins in amoebic dysentery, and uniform, that is regular, even, smooth margins in bacillary dysentery. Intervening mucosa means normal mucous membrane present between two ulcers or lesions, which is normal in amoebic dysentery and inflamed in bacillary dysentery. Cellular response is mononuclear in amoebic dysentery. Mononuclear means WBC with single non-lobe nucleus, and polymorphonuclear in bacillary dysentery. Polymorphonuclear means WBC with multilobe or segmented nucleus. Next, stool microscopic feature. In this, number of motions in amoebic dysentery 6 to 10 per day and more than 10 per day in bacillary dysentery. The amount is copious. Copious means very large amount in amoebic dysentery and small quantity in bacillary dysentery. The color is dark red in amoebic dysentery and bright red in bacillary dysentery. The odor is offensive in amoebic dysentery and odorless in bacillary dysentery. The reaction is acidic in amoebic dysentery and alkaline in bacillary dysentery. The consistency non-adherent to the container. Adherent means sticking firmly or attaching to something. So in amoebic dysentery, it is not sticking firmly to the container, and in bacillary dysentery, it is sticking firmly to the container. Now Stool microscopic feature. So red blood cells in clumps. Clumps means small group or in clusters in amoebic dysentery, and discrete or in Rowley's in bacillary dysentery. Discrete or in Rowley's means separate, not attached to each other or coin-like piles, which is in bacillary dysentery. Now, pus cells are few in amoebic dysentery and numerous in bacillary dysentery. Macrophages are few in amoebic dysentery and numerous in bacillary dysentery. Eosinophil present in amoebic dysentery and absent or rare in bacillary dysentery. Charcot Leyden crystal is present in amoebic dysentery and absent in bacillary dysentery. Pynotic body is present in amoebic dysentery and absent in bacillary dysentery. Organism detected E. histolytica cyst or trophozoite in amoebic dysentery and bacteria, for example, Shigella in bacillary dysentery. Now, lastly, we will see the laboratory diagnosis of amoebiasis. Stool examination is done. Macroscopy. Weight mount stain. Detect cyst round 1 to 4 nuclei. Detect trophozoites with finger-like pseudopodia. Culture is done, that is polygenic and exenic culture, not routine. Histology. In histology, biopsies from intestine are done and stained with PAS or HNE, shows trophozoites. Stool antigen detection is done, that is coproantigen test, ELISA test, detects 170 kDa lectin antigen, and ICT, that is rapid test, detects 29 kDa surface antigen. Then serology is done, that is blood test is done. Detect amoebic antigen ELISA, detect amoebic antibody ELISA, useful in extraintestinal amoebiasis. Then isoenzymes or zymodim analysis is done, which differentiates pathogenic E. histolytica from non-pathogenic E. diasper. Then molecular diagnosis is done, that is PCR method, nested multiplex PCR, real-time PCR, 18S rRNA, biofire film array, that is rapid molecular panel is done. So in short, the laboratory diagnosis in E. histolytica is routine examination, that is stool microscopy and stool antigen detection, and confirmatory or advanced test is serology, isoenzyme analysis, all molecular test is done. So this is all it about Entamoeba histolytica. Now like, share and follow and subscribe for more such videos. Thank you.